Hypoplastic left heart syndrome, or HLHS. It's a rare and serious heart condition that a baby is born with. Today, we'll explain what it is, how it affects the heart, and how modern medicine helps these children survive and grow. HLHS stands for Hypoplastic left heart syndrome. Hypoplastic means underdeveloped. In this condition, the left side of the heart does not form properly during pregnancy. The left ventricle, the main pumping chamber that normally sends oxygen-rich blood to the body, is too small or nearly absent. The mitral valve, aortic valve, and the aorta itself are also usually underdeveloped or blocked. In a typical heart, the right side pumps oxygen-poor blood to the lungs. The left side then pumps oxygen-rich blood out to the rest of the body. Each side has its own job, and they work together as a team. In a baby with HLHS, the left side cannot do its job. Oxygen-rich blood returning from the lungs cannot easily enter the left ventricle. Instead, it crosses through an opening between the upper chambers into the right side of the heart. The right ventricle must pump blood to both the lungs and the body. Before birth and for a short time after, two natural connections help: the foramen ovale and the ductus arteriosus. These keep blood flowing to the body. After birth, these openings normally close. When that happens in a baby with HLHS, blood flow to the body becomes severely limited. Without treatment, HLHS is life-threatening within days. Babies with HLHS may look healthy at first, but as the ductus closes, signs appear: blue or gray skin color, especially around the lips and nails, fast or difficult breathing, trouble feeding, weak pulses and cool extremities, and unusual sleepiness or low energy. These are emergency signs. HLHS is often detected before birth during a routine ultrasound or a specialized fetal echocardiogram. After birth, an echocardiogram, an ultrasound of the heart, confirms the diagnosis. Treatment begins immediately with medication to keep the ductus arteriosus open. Most babies then undergo a series of three-staged surgeries known as single ventricle palliation. Stage 1, the Norwood procedure, is done in the first days or weeks of life. Surgeons rebuild the aorta and turn the right ventricle into the main pumping chamber for the body. A temporary shunt supplies blood to the lungs. Stage 2, the Glenn procedure, is usually performed between 3 and 6 months. Blood from the upper body now flows directly to the lungs, reducing the heart's workload. Stage 3, the Fontan procedure, is typically done between 18 months and 4 years. Now all oxygen-poor blood flows passively to the lungs without passing through the heart. The single right ventricle pumps only oxygen-rich blood to the body. These surgeries do not create a normal heart, but they create a workable circulation that allows children to grow and live. With advances in surgery and care, many children with HLHS now survive into adulthood. They require lifelong monitoring by congenital heart specialists because the single ventricle circulation carries long-term challenges. Some children may need additional procedures or, in some cases, a heart transplant, but with dedicated care, many lead active, meaningful lives. HLHS is a complex condition, but understanding it is the first step toward hope and informed care. If you or someone you love is facing this diagnosis, you are not alone. Specialized heart centers and dedicated teams are ready to support every step of the journey.